Women have urinary incontinence problems, but many times it's associated with other things occurring as well. This is a haste MRI. It's really a miraculous diagnostic tool because it really gives us the ability to look inside our bodies and see how things really are. In this case, the bladder is normally supported by the pelvic floor muscles. However, under circumstances like this, where there's just some muscle weakness, the bladder moves or rotates and falls back into the vagina. When the bladder moves, the muscles that control the urine for women aren't nearly as efficient as they otherwise could be, and this is where we see a very common problem called stress urinary incontinence. Stress incontinence is essentially when the bladder is full and the muscles that are designed to provide resistance to hold it in can't get the job done. It's essentially a hernia of the urethra or a hernia of the bladder. It's a common problem. Probably well over 50 million women are involved on an annual basis who have to deal with this situation. How do we go about understanding this? Well, first you have to decide that you want to solve your problem. And when you come to the urologist or your family physician or your gynecologist, you have to give them a history. You have to tell them what's going on and when you notice the problem and what makes it worse and what you might do to make it better. And we have even more sophisticated studies where we actually look at the functional abilities of the bladder to store and to empty, and we can learn about how the bladder is working. But we have to combine that not only with the anatomy, but with the understanding of how these muscles are coordinated. Stress loss of urine usually is most noted during possibly later times of the day when the muscles in the pelvis are fatigued, when the bladder is full, and when your activity levels are highest, such as lifting or coughing, sneezing, running, playing tennis, things of that nature. And what we want to do is learn how to keep that from happening. Slings are really biocompatible materials that we can put into these areas that have weakened or the hernias to strengthen them and keep the organ systems in their appropriate position. In this illustration is a sling that is supporting the urethra so it can't rotate, move, and lose the ability to function normally. This is a minimally invasive procedure, meaning there's no big incision. We actually can place these with needles in such a way that there's just very small indication that anything occurred. And I've had many patients who've told me that it was a moment that really changed their life in a very positive manner. You don't have to live with incontinence. There are many things that we can do for it, but probably the most important thing is you have to recognize that it's a problem for you and you have to seek help. Falling out, what's that about? Well, we indicated a little while ago that the muscles in the pelvis not only support the bladder, but they support the bowel and they support the rectum. And when these muscles are weak, there can be a significant bulge that just seems very abnormal. Things that may create this situation are time in life, such as menopause, pregnancy. There are neurological problems that can weaken the muscles in the pelvis. Just getting older can be a major contributing factor. Being overweight, which is a very common problem in our society. A cystocele is when the bladder literally falls into the vagina. Again, we go back to the haste MRI, which is very informative in understanding what actually has occurred. Here we can see a very significant protrusion of the bladder into the vagina, and it's a very large cystocele. And the bulging that occurs in the vagina is the protrusion of the bladder. There are a number of ways to repair these kinds of problems. Recently, there have been innovations that have allowed us to repair this problem with minimally invasive technology. And once again, just like with the slings, we can use needles and biocompatible materials and replace the weak tissues and reposition the bladder in such a way that it'll be in its normal location. I'd like to overview with you what I think is really an innovative development in female urologic treatment. Here we can see the bladder as it's pushing the vaginal wall forward. We make an incision so that we can appreciate the location of the bladder, and then we make incisions where we can pass needles through the muscle and bone that supports the implant. The anatomy is important, and that's why these technologies have taken a while to develop. At the same time, we want to repair the defect that has allowed the bladder to herniate into the vagina. Now, with all four support systems in place, we push the mesh through the incision in the vagina underneath the bladder, and then we pull the tapes that support this mesh in such a way that it provides some tension, and this reconstitutes the pelvic floor. The bladder can then rest on this support system and no longer falls or herniates into the vagina. Operations like this used to put people in the hospital for 10 days. Today, we can do this as an outpatient. You walk in and your surgery is complete within a matter of an hour and a half, and it's very probable that you'll go home the next morning, if not the same day. We're very happy to have you call and talk with our personnel. We invite you to come to the office. I think we can show you in more detail circumstances that you will find are interesting and things that will make your life better once you fully understand them. We can make tomorrow better for you than today was. Thanks for watching.